All right, introduce yourself.
My name is Dr. Sean Davis. I'm a sports medicine fellowship trained orthopedic surgeon that works at Utah Orthopedics.
All right, tell us about ACL. What is an ACL?
So, ACL is one of the main stabilizing ligaments of our knee. It's one of two ligaments that we call intra-articular, which means it lives inside the knee joint itself. There are a couple inherent things that we understand about intra-articular ligaments. One is that it receives most of its nutrition from the fluid inside the knee. And the other is that it doesn't really have a dedicated blood supply in essence.
How does it commonly get injured?
Typically, it's from a non contact injury, so a cutting, jumping, or pivoting event where you feel a large pop within the knee, and then over the next 24 hours or so, the knee swells significantly, and you start to have experience pain as a result of the ACL being torn.
And how would someone go about getting that fixed or repaired?
So when we talk about fixing an ACL, really what we're talking about is reconstructing the ACL for the two reasons that I outlined earlier. One being that it doesn't have a great blood supply, so it doesn't really have the potential of healing on its own. And the second being that it receives most of its nutrition from the fluid inside of the knee. So when we're talking about fixing ACL, really what we're talking about is reconstructing it. We can do that two primarily different ways. One is using cadaveric, or what we call allograft tissue, which means it comes from a deceased person, and the other being allograft, or excuse me, autograft tissue, meaning that we take it from your own body and use that to reconstruct the ligament.
Wonderful. Thank you, Dr. Davis. That's it.